Module Overview. Pain and symptom management form the clinical heart of palliative and end-of-life care. The goal is not curative but comfort-oriented, reducing physical, emotional, psychological, and spiritual suffering in a holistic manner. This module offers an in-depth exploration of assessment tools, pharmacologic and non-pharmacologic interventions, patient-centered care strategies, and ethical practices in managing pain and other distressing symptoms. It equips you with evidence-based skills and compassionate decision-making frameworks to ensure patients live their final days with dignity, relief, and peace. The module also explores cultural interpretations of pain, myths about opioid use, barriers to access, and ethical concerns in sedation, dosage titration, and end-stage symptom interventions like breathlessness and delirium. Learning objectives. By the end of this module, you will be able to understand the pathophysiology and types of pain experienced in terminal illnesses, utilize standardized pain and symptom assessment tools across age groups and conditions, design effective individualized pain management plans, integrating pharmacological and non-pharmacological therapies, address symptoms like dyspnea, fatigue, nausea, anxiety, terminal restlessness, and cachexia with targeted interventions. Tackle opioid management, myths, ethical dosing, and side effect prevention strategies. Integrate interdisciplinary approaches, including spiritual, emotional, and psychological care. Practice culturally competent and ethically sound symptom relief. Understanding pain in palliative care. Pain is not just physical, it can be total pain, encompassing physical pain, disease, inflammation, tumors, ulcers, pressure sores, etc. Emotional pain, depression, anxiety, loss of identity, spiritual pain, existential suffering, loss of meaning, fear of death. Social pain, isolation, abandonment, unresolved relationships. In palliative care, we manage pain holistically, understanding the subjective nature of pain perception, especially among patients with cognitive decline or nonverbal conditions. Pain assessment tools. Tool name target group. Key features numeric pain rating scale adults. Scale 0 to 10. 0 equals no pain, 10 equals worst. Wong-Baker Faces scale. Children. Elderly uses facial expressions to represent pain. FLSCC scale. Nonverbal patients. Facial expression, legs, activity, cry, consolability, Abbey pain scale. Dementia patients, behavior-based observations, ESAS, Edmonton Symptom Assessment System. Terminal illness measures pain, fatigue, drowsiness, nausea, anxiety, well-being. Pharmacologic management of pain. 1. WHO Analgesic Ladder, revised. A global guideline for pain management. Step 1. Non-opioids, paracetamol, NSAIDs. Step 2. Weak opioids, tramadol, codeine. Step 3. Strong opioids, morphine, fentanyl, oxycodone. Each level may include adjuvants, e.g., anticonvulsants, antidepressants, steroids, depending on the pain type. Opioid use principles. Start low, go slow. Titrate for effectiveness and tolerance. Watch for constipation, respiratory depression, sedation. Educate patient/family to reduce fear of addiction, monitor liver and kidney function. 3. Breakthrough pain management. Use fast-acting opioids, e.g., immediate-release morphine. Regular reevaluation and dose adjustments. Record pain patterns and triggers, non-pharmacologic interventions. Massage therapy, aromatherapy, heat, cold, compresses, music and art therapy, breathing exercises, cognitive behavioral therapy, CBT, acupuncture, spiritual care, and guided imagery. These modalities offer complementary relief, especially for patients with opioid intolerance, cultural objections, or psychological distress. Common symptoms in end-of-life and their management. Symptom cause management. Dyspnea, shortness of breath, lung disease, heart failure, anxiety, morphine, low dose, oxygen, fan therapy, positioning, nausea, vomiting medications, tumors, metabolic issues. Ondansetron, metoclopramide, small frequent meals. Delirium, agitation, organ failure, infection, medications, haloperidol, reorientation, calm environment, fatigue disease progression, anemia, meds, energy conservation, steroids, rest activity balance, constipation, opioids, immobility, poor diet, laxatives, hydration, stool softeners, anxiety and depression, fear of death, unresolved issues, counseling, antidepressants, spiritual support, cachexia, and anorexia cancer, organ failure, appetite stimulants, nutritional counseling. Ethical and cultural considerations. Over-medication versus under-medication, ethical balance of relieving suffering without hastening death. Sedation at end of life. Use of palliative sedation must be judicious and documented. Cultural pain expression. Some cultures suppress pain, others vocalize it, respect both. Spiritual expressions of suffering. Include chaplains, imams, or traditional healers as needed. Self-care and pain. Management for providers. Be aware of vicarious trauma and empathy burnout. Engage in team debriefs and professional supervision. Practice mindfulness and reflective journaling. Module 3, Summary, Pain and Symptom Management. Go beyond clinical skills. They require compassion, cultural sensitivity, ethical clarity, and interdisciplinary teamwork. By integrating evidence-based medicine with human-centered values, palliative care providers can deliver relief that is meaningful, effective, and dignified. This module ensures that you are professionally prepared, emotionally intelligent, and clinically competent to care for patients at their most vulnerable stages.